Name one of Paracelsus's contributions to toxicology. Paracelsus is rightly considered the father of toxicology, and his pivotal contribution lies in his assertion that the dose makes the poison. He highlighted that therapeutic and toxic effects are often two sides of the same coin, a principle that remains foundational even today. For instance, digitalis, derived from the foxglove plant, is life-saving in controlled doses for heart failure but becomes lethal at higher concentrations, causing dangerous arrhythmias. Paracelsus also championed the transition from superstition to experimental science, encouraging a systematic study of chemicals and their targeted actions on the body, thereby laying the groundwork for both modern pharmacology and toxicology. Why is experimentation important in toxicology? Experimentation forms the backbone of toxicology as it enables controlled observation of how living organisms respond to various toxicants. It turns hypotheses into tangible data. For example, through experimental studies, scientists can determine safe exposure thresholds such as the NOAEL, no observed adverse effect level. Experimentation has also been vital for antidote development, confirming their efficacy before clinical application. A real-world example includes feed trials in poultry, which established safe limits for mycotoxins, specifically restricting aflatoxin contamination to below 20 ppb to prevent liver damage. Experimentation thus converts theoretical risks into measurable outcomes, guiding safe practices. How do we describe exposure routes in toxicology? Exposure routes refer to the pathways through which toxicants enter an animal's body, directly influencing the severity, onset, and nature of toxic effects. The main routes include ingestion, inhalation, dermal absorption, and injection. For example, pets may accidentally ingest rodenticides left in accessible areas, resulting in gastrointestinal absorption and systemic toxicity. In poultry farms with poor ventilation, inhalation of ammonia fumes can severely irritate the respiratory tract. Dermal absorption becomes a concern with pesticide exposure during handling, while venom from snake bites represents injection exposure. Identifying the exposure route is critical, as it determines both urgency in the choice of decontamination or therapeutic intervention. What factors influence toxic responses in animals? Toxic responses in animals are shaped by multiple interdependent factors. Species variation plays a crucial role. Cats, for example, are particularly vulnerable to paracetamol due to deficient glucuronyltransferase enzymes in their liver. Age is another determinant, with young animals having immature detoxification systems and older animals potentially suffering from reduced metabolic clearance. Dosage and exposure duration are vital considerations. While a single high dose may cause acute toxicity, chronic low-dose exposure can result in cumulative damage. Nutritional status also matters, as selenium-deficient livestock are more susceptible to certain plant toxins. Finally, the underlying health of the animal affects how efficiently its body can process and eliminate toxicants, making these factors essential in diagnosis and treatment planning. Can essential elements be toxic? Absolutely. Essential elements sustain life but can become toxic when their levels exceed physiological needs, a concept known as nutrient toxicity. Iron, vital for hemoglobin synthesis, can become deadly if overdosed in piglets through iron dextrin injections, leading to organ failure. Copper is another example. While essential, it accumulates in the liver of sheep if dietary intake is excessive, eventually causing jaundice and hepatic necrosis. Such instances highlight Paracelsus' timeless wisdom that even life-sustaining substances can act as poisons when consumed beyond safe limits. What is chronic exposure? Chronic exposure refers to sustained or repetitive contact with a toxicant over an extended period, often weeks, months, or even years. Unlike acute exposures, chronic exposures may not cause immediate symptoms but progressively damage organ systems. For example, cattle grazing on forage contaminated with fluoride over several months can develop dental and skeletal fluorosis, resulting in brittle bones and tooth damage. Similarly, poultry consuming feed laced with low but persistent levels of aflatoxin are at risk of developing liver cancer over time. Chronic exposures demand vigilant monitoring and preventive strategies to avoid long-term harm. What is acute exposure? Acute exposure involves a single or short-term event where an animal encounters a high dose of a toxicant, producing rapid and often severe clinical signs. Consider a dog consuming a large quantity of chocolate, which contains theobromine, leading to vomiting, hyperactivity, tremors, or even seizures within hours. In another scenario, livestock inadvertently fed heavily fertilized grain rich in nitrates may develop toxicity rapidly, presenting with weakness, dyspnea, and sudden death. These situations necessitate swift veterinary intervention to prevent fatal outcomes. Define hazard in toxicology. A hazard is the intrinsic property of a substance to cause harm under certain conditions. For instance, botulinum toxin ranks among the most hazardous substances known due to its extreme potency, capable of causing fatal paralysis in minute doses. Similarly, snake venom is inherently hazardous but remains harmless as long as it is safely contained and not introduced into the body. It's crucial to understand that hazard alone does not equate to risk. Risk also involves the likelihood and circumstances of exposure. What is risk in toxicology? Risk is the probability that harm will occur when an organism is exposed to a hazardous agent. It depends on several variables, including the inherent hazard of the substance, the dose, duration of exposure, and the vulnerability of the exposed animal. Cyanogenic plants, for example, contain hazardous compounds, but their risk to livestock remains low if alternative forage is available. However, during droughts, when animals are forced to consume these plants excessively, the risk escalates significantly. Veterinary toxicologists assess both hazard and exposure to accurately predict and mitigate risks in field conditions. What is risk communication? Risk communication is the process of clearly conveying potential hazards and associated risks to those who need to act on this information, such as farmers, pet owners, and policymakers. Effective communication demystifies complex scientific data, helping stakeholders make informed decisions. For example, veterinarians educating dog owners about the dangers of feeding grapes, which can trigger acute kidney failure, is a critical risk communication activity. Similarly, advising farmers on mold prevention in silage to reduce mycotoxin risks enhances food safety. Successful risk communication builds trust and promotes proactive management of animal health threats.